When you have pelvic girdle pain, either before, during, or after pregnancy, and you've found relief with a maternity belt, it's important to remember that exercises should accompany your program. So there are 3 stages of exercise training for pregnancy-related pelvic girdle pain. Stage 1 is a cognitive stage, meaning that we need to wake up or remember how to use the muscles that aren't being recruited, because you can't strengthen a muscle that your brain isn't using. Stage 2 is where we need to build capacity or strength and endurance in both the muscle and also within the nervous system. So in pregnancy-related pelvic girdle pain, when you are still at a stage where you're needing a support belt, stage 1 and stage 2 exercises are appropriate. Stage 3 training comes after you have gotten off the belt, not needing it anymore, and they're a more higher level of training. So for stage 1 training of the lower abdominal muscles, the key muscles that we're focusing on are the lowest fibers of transversus abdominis and the internal oblique. And those are the muscles that go from the inside of your hip bones across to the middle here. These are the muscles that we are focusing on. And a reminder, stage 1 training is about finding the muscle and waking it up. There is no movement involved in terms of movement of the skeleton in stage 1 training, okay? And it looks like this. All right, so come down into a very small, little tiny squat for me. Just so that, not quite so much like that, up a little bit more. Good, and then just bend your trunk forward a bit. Put your hands on your lower tummy. Good, and the first thing to do is just really let your belly go. Really let your belly go. Let your back soften. Imagine your spine growing long at the back. Good. And then just give up your belly into your hands. Now, we know from the evidence that transversus is reflexly connected to a contraction of the pelvic floor. So that's where we're going to begin. So very gently now, I want you just to think about lifting the muscles of your pelvic floor and then let it go. Really let your belly go. And what you should see when transversus contracts is it should start with a low belly lift off her hands. So connect your pelvic floor, beautiful. Her navel should draw to spine, and then you see the upper abdomen come in. Relax again, and connect to your pelvic floor. Good, and she's doing this perfectly. Now, often what will happen, let your belly go. This time when you connect, I want you to think about bearing down. So connect, and then relax. So push down when you connect. That's what you'll often see. So you'll see the abdomen get more pressurized, it will contract in here, and the belly will actually get bigger. That's a Valsalva. That's not the contraction you're looking for. You are looking for the low belly to lift, navel to draw to spine, and a very gentle drawing in at the top. That is, come on back up to standing, that is a stage 1 contraction of the deep muscles of the abdominal wall, namely the low, then the middle, then the upper fibers of transversus. For pelvic girdle pain, the key muscle to get working is these lowest fibers of TrA and the internal oblique. So how many and how often of these stage 1 exercises should you do? We like to build to a dosage of 3 sets of 10-second holds with a 2-minute rest in between. So if you are able to lift, hold, and even count to 5 or 7, and then let it go, that is a dosage that I'm quite happy with my clients. And to be able to repeat that for up to 30 repetitions, and then repeat this exercise 3 to 4 times a day. If you do that consistently for 2 weeks, then your deep system, transversus, will be back online, and you'll be able to move into stage 2 exercises. So once you've been able to recruit and find the deep muscles of the abdomen, it's time to move into stage 2 training, which is about building capacity and endurance. And this is a stage where you may still be wearing your pelvic support belt. So it goes like this in a squat task. So come down into your squat for me now. Shift your weight onto your right leg. Shift your weight onto the left leg. Shift your weight onto the right leg. Deepen the squat. And now see if you can actually start to tap the left toe for 12 o'clock, 9 o'clock, 6. And she's doing this really, really well without support. But watch what happens on the other side. Shift over to the left. Stay connected now. Same thing, toe taps. And what you can see is it's harder for her to keep her knee over her foot. She's struggling to maintain a line of support through her foot because she doesn't have enough pelvic compression. So let's watch the same exercise when you've got the addition of the Maternity Support Belt by Diane Lee. Now that we have the belt on, let's see how much easier it is for her to perform this stage 2 task. So first thing you want them to do is connect first. Yes, go down into the squat. Shift your weight onto the left leg. Keep that connect cue now as you do your toe taps. So with the belt on, it gives the pelvis that extra hug it needs so that she can start to train the low fibers of transversus, the internal oblique, and all the other muscles necessary for her to build strength and capacity to self-lock and force close the pelvis and provide the stability that she needs. So again, the number that she would do with this, come on back up to standing, would be 3 sets of 10, 10-second hold taps, and then come on back up. 3 to 4 times a day. That would be a progression from stage 1 to stage 2 training. So this is another stage 2 exercise which involves loading through the arms and loading through the pelvis at the same time. So to set up for this exercise, you need a very long piece of elastic band, and you have the person just step on 2 parts of the band and to hold the band in their hands like this. They then come down into a very small squat, and then waking up the deep system, stage 1. Head up a little bit. And now, from this position here, 1 arm at a time, you're just going to bend your elbows up and back down. And now just do the right arm and down, and the left arm and down, and both arms. So a bilateral arm task will put a flexion load through the spine. A unilateral load will challenge rotation control. So you need both. A progression to this would be to do this with a straight arm. Lift 1 arm forward, back, staying connected. Left arm forward. Now, of note, just keep going with this. We have to integrate this system with breathing. I don't want her holding her breath the whole time she's doing it. So we exert on the exhale breath. So take a small breath in. As you breathe out, connect, then pull. Breathe in, connect, breathe out, and pull. So we exert on the exhale breath. All right, so coordinating the breath with these exercises is really important. You don't want to teach mom to hold their breath and exercise, okay? So that's stage 2 training for arm loading, and it puts both a rotation challenge onto the spine, and it also will help to strengthen arms for lifting babies. So this is an alternate position for stage 2 training for the abdominal wall in pregnancy. So we start off in the hands and knees position with the femurs 90 degrees to the back and the shoulders, the wrists directly under the shoulders, okay? And we're going to first of all establish a neutral spine position by having the patient go up into what we call a Halloween cat. Good. And then start coming back down to neutral. Stop here. Now just let your pelvis tilt forward a little bit more. Pelvis, 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 tilt. Go the other way. Go the other way. Relaxing. Yeah, there you go. A little more of an anterior tilt. A little more, a little more. Now pick this up a bit. There you go. That is pretty close to a neutral spine position. Okay? Now, once you've established the neutral spine position, we then ask the person to let your belly go. And now she connects to either her pelvic floor or to her low abdomen. And what you should feel is the low belly lift before the middle belly, before the upper belly. Hold for 3 to 5 seconds and then slowly let it go. Now let's integrate this with breathing. Take a small breath in. And as you breathe out, connect to the pelvic floor. Feel the low belly lift on the exhale breath. Inhale to let go. Don't let your spine move. Come down again here a little bit. Good. And exhale and lift. Hold 2, 3, 4, 5, and release. Keep going. So the dosage for this exercise is to aim to do 3 sets of 10-second holds with a 2-minute rest in between. So she lets her belly go. On the exhale breath, connect, hold up to 5 to 7 seconds, and then release. Inhale, exhale, lift, hold, and then release. And again, same as the other exercise, you want to be doing this 3 to 4 times a day, building capacity of the deep abdominal wall. Stage 2 training. To move into stage 3 training, we'd be doing things like walking lunges or things where the pelvis is actually moving in space. But as soon as you're starting to rotate the thorax on the pelvis or move the legs in a way that the pelvis twists, you're now moving into a more complex exercise, and we call that stage 3 training.